Hi everyone, my name is Whitney and I am a dental hygienist. Dentistry has changed a lot over the past couple of decades. From switching from traditional film x-rays to digital x-rays and even incorporating 3D scanning, we in the dental industry have experienced huge shifts in the way we care for our patients. And now the abrupt changes in patient care due to the COVID-19 pandemic have transformed dental office experiences for patients and team members alike. But this isn't the first time that's ever happened. Let's step back in time for a moment. Before the HIV/AIDS epidemic in the 1980s, a lot of dentists didn't even wear gloves. The more we learned about how diseases spread and what the right PPE was to protect ourselves, patient care measures were different. That's exactly where we find ourselves today during the COVID-19 pandemic. And although your dental team was already masking up and wearing gloves to begin with, there are some differences in what it looks like visiting a dentist post-COVID than it did pre-shutdown. Now, there's one important thing you need to know. One of the things that makes dentistry different than medicine is that dental health professionals are regulated within their state of practice. So what one state decides to do or restrict may not be the same thing another state decides. For example, most hygienists, like myself, can administer local anesthetic, but there are a couple of states where that's actually illegal to do. So back to COVID. When dental offices started reopening after the initial COVID-19 shutdown, each state had to look at the CDC and American Dental Association for guidance, then interpret their recommendations for themselves. The ADA pretty much said to do what the CDC recommends, so some of the decisions needed to be made were left up to the state dental boards and individual dentists' best judgment. Depending on where you live, your trip to the dental office may look completely different than it did before. Or it might seem almost identical. But in general, post-COVID, most dental offices will conduct a pre-screening where they call you to confirm your appointment. They'll ask if you've tested positive for COVID-19 before and if you've been around anyone who has. They may also ask if you've traveled outside of the country, if you're experiencing any symptoms, or if you've had your vaccine. Then, once you get there for your appointment, they'll probably take your temperature. Some offices even have a sign on the door telling you to stay in your car and call from your phone to check in. That way they can stage patients so that no two people are crossing paths when they're checking in and out for their appointment. A lot of this can depend on the physical size of the dentist's office building. At this point, things can fluctuate. Like I said, depending on where you live and the preference of your dentist. Some offices are limiting the equipment they're using, such as those that create aerosols, such as the ultrasonic scaler. Others may book longer amounts of time for each appointment to allow dead air time between treating patients. And then there are the offices that have invested in tons of high-tech equipment to physically suction aerosols out of the room or immediately away from the patient's mouth during procedures. The one thing that is still the same, treating active disease and keeping you on a preventative care plan to ensure your smile stays healthy. That means getting back to your normal 6-month checkups, taking x-rays to screen for cavities, and intercepting cavities or gum disease as soon as it's diagnosed. Like we talked about last time, the delay in dental care and onset of mask mouth created more problems for dental patients during the COVID-19 pandemic. Right now, the safe thing to do is to get back to your dentist, to make sure your smile stays healthy and to avoid those otherwise preventable toothaches while it's still an option. If you haven't seen your dentist in 6 months or longer, it's time to change that. I hope you'll join me next time. Until then, keep smiling.